Good afternoon, everyone. Thank you for joining us today. My name is Dr. Quan McKenzie, and I'm the CEO of Wellesley Institute. Welcome to part 3 of Advance 2021, Building a New Normal. Before we begin, we wish to acknowledge the land on which Wellesley Institute operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of Credit. Today, this meeting place is still the home to many Indigenous people, and we are grateful to have the opportunity to work on this land. Now, we're nearly 20 months into living through the COVID-19 pandemic, which has exposed many historic and systemic inequities. And I'm sure you've been thinking about how we prioritize equity as we build the new normal. And that's what we've been exploring through our virtual symposium series. Now, in our first 2 sessions, we had fantastic panelists discussing the differential impacts of COVID-19 on certain communities, and then the housing crisis and the rise of evictions and encampments. In both sessions, we explored not just the problems, but solutions for the problems and how we can improve health and health equity as part of building the new normal. Today, we continue our conversations on how we build the new normal with a discussion about income inequality. Now, income inequality is a social cancer which makes our communities weaker and damages our health. And COVID-19 has made things worse. The rich have got richer and the poor are getting poorer. We've seen a housing boom, we've seen a stock market boom, we've seen a cost of living boom, and meanwhile, unemployment in Canada for people who earn less than $500 a week is 13% higher than pre-pandemic levels, and income supports are being phased out at the same time. What does that mean for building the new normal? Well, we'll be looking at income inequality and health and what can be done about it from 3 different vantage points. We'll hear about social policy, income equity, and social change. We'll hear about a universal basic income. And last, we'll hear the perspective on the ground from one of our leading charities working in food security. But before we start, a few housekeeping notes before I introduce our panelists. We're going to start with our panelist presentations, and then we'll come back for discussion. And I'd like to thank everyone who's already submitted questions online through the event page. But if you haven't done that, feel free to use a question and answer function, and we'll try to get to your question. And also, if you don't want to ask a question, but you want to join the conversation on Twitter, you can do so using the hashtag #Advance2021. So #Advance2021. So as I said, we've got 3 remarkable panelists that we're going to hear from today, and I'm just going to go through them one by one. First, we have Dr. Ichiro Kawachi joining us from Boston, Massachusetts. Ichiro is a physician and epidemiologist who's trained at the University of Otago, New Zealand, but has been at Harvard University, a prof at Harvard University School of Public Health since 1992. He is co-editor of the first book on social epidemiology, the first textbook on social epidemiology, and his other books include Behavioral Economics and Public Health, Neighborhoods and Health, and Social Epidemiology of Sleep. Dr. Kawachi is also the co-editor-in-chief of Social Science and Medicine, and he's an elected member of the US National Academy of Medicine and also an honorary fellow of the Royal Society of New Zealand. Welcome, Dr. Kawachi.
Thank you, Kwam. It's a pleasure to be here. So I've been asked to address some remarks about the intersection between COVID-19 and income inequality. As Kwam just said, income inequality is a social cancer. It's almost universally recognized in the social sciences as being a social bad. Income inequality erodes social cohesion. It stifles economic growth and social mobility, and threatens the functioning of democracy. And to that long list of social ills, my research has been devoted to understanding the damaging effects on population health. And so I'd like to make some remarks about how income inequality, the path through which income inequality may affect population health, of which we can think of two or three. This is an argument that builds upon work of my colleagues Richard Wilkinson and Kate Pickett, whose books you may well have read. They say that unequal societies are characterized by syndemic high rates of violence, of physical and mental illness, of drug abuse, imprisonment, low levels of cohesion, as well as low levels of child well-being. And when we sort of put this picture together with COVID-19, a global crisis like COVID-19, we have almost the perfect set of preconditions for bad effects to arise. So the mechanisms by which income inequality led to damaging population health consequences are as follows. First, unequal societies have tended to suffer a higher caseload of infection. Compared to more egalitarian countries, societies with high inequalities tend to be characterized by large numbers of people with precarious and fragile economic circumstances. Large numbers of people with precarious jobs, housing insecurity, food insecurity, as well as lack of access to healthcare. And all of this translates to a higher caseload of infection. I mean, one can think of a scenario where, as a result of business closures last year, many people lost their jobs, and as they lost their incomes, a lot of them had to double up in their accommodation with relatives, friends, and this kind of housing precarity led to a concentration of transmission of SARS-CoV-2 virus in these households and in these communities. That's one way in which we have a higher caseload of infection. The second reason is that when people do become affected, the consequences of infection tend to be more severe in societies with high inequality. And the reason is because, as I already said, unequal countries tend to have already ongoing syndemics of problems like obesity, high blood pressure, diabetes, and other chronic conditions. And as we have learned during the past year and a half, if conditional on becoming infected, the consequences are much more severe when there is an underlying syndemic of these conditions. People are much more likely to end up becoming hospitalized or even dying from the disease. And we've seen this play out exactly along lines that reinforce pre-existing social divisions. In my country, the United States, we've seen the burden of hospitalization and mortality being concentrated in communities that are already suffering from the ill effects of inequality. For example, racial and ethnic minority communities, which were already oppressed by systemic racism prior to the pandemic, as well as populations like immigrant populations who are in precarious jobs with little or no collective bargaining rights. So those are the two ways in which inequality has amplified the consequences of the pandemic. But the third and additional reason why income inequality is so important is because unequal societies, we have discovered, ill-prepared to deal with crises such as pandemics, because any response to a global crisis like this requires coordinated action and cooperation. And we have now discovered that unequal societies are very poor at mounting an effective response. First, we have the prevalent free market ideology that makes countries unequal, that ideology which emphasizes individual liberty and competition above cooperation and doing things for the public good. And all of this is reflected in the inability of unequal countries to find consensus and to reach consensus quickly on the protective measures that people need to take in order to protect themselves, their communities, and their loved ones. So I think the pandemic has done nothing except to reveal the underlying vulnerabilities in such societies. And that's the direction which I'd like to address any answers to questions that people may have. Thank you.
That's a perfect start, because we know that the rates are worse. We know that survival's worse in unequal societies, and to have that distillation of why this happens, the pathways that lead to unequal societies having worse COVID outcomes and worse pandemics, is really, really useful for now thinking about what can be done about it. So thanks very much, Dr. Kawachi. That was brilliant start. And now we move on to Dr. Evelyn Forget, and she's joining us from Winnipeg, Manitoba. And Evelyn is a professor of economics and community health sciences at the University of Manitoba in Winnipeg. Her research examines the health and social implications of poverty and inequality, and she often works with governments, First Nations, and international organizations to advise on poverty, inequality, health, and social outcomes. Evelyn was first introduced to the idea of the basic income as a student studying in economics in Toronto, and recognized that a guaranteed income delivered with dignity would have made a tremendous difference in her own life and the lives of her friends and neighbors when their family faced difficult times. Her research on the 1970s Mincome experiment in Manitoba has really increased interest in the basic income across Canada, and her most recent book is titled Basic Income for Canadians: From the COVID-19 Emergency to Financial Security for All. Welcome, and we really look forward to your comments. Evelyn.
See, I'm muted. Thank you very much, Kwam. I'm delighted to be here today. I think COVID-19 showed us very clearly how both a health threat, like a pandemic, and the public health measures put in place to address that pandemic affect families very differently, depending on their social and financial resources. At the outset of the pandemic, before the vaccine was widely available, our first public health response was social distancing. And we saw very quickly that social distancing wasn't the same for all of us. No matter how complete the lockdown, essential workers were expected to continue to work and to expose themselves and their families to risk. Now, essential workers, of course, come at all different income levels, but those at the lowest income levels navigated the risk without the income that would have allowed them to protect their families or to undergo regular testing. Adequate housing, the ability to limit social contacts, safe access to space outside the home, the ability to travel to obtain testing, these were all constrained for those with the lowest incomes. Students struggled to learn with inadequate Wi-Fi, in overcrowded housing, and with poor supports. And the stress is multiplied for families at the bottom of the income distribution. Those for whom their families were not safe places lost access to whatever outside supports they might have had in place before the pandemic. The pandemic, however, also showed us that a government can offset this differential impact to a very great extent by making available income supports to those most affected. And they can do that without excessive bureaucracy, without needs testing or punitive attitudes that are common in many of our existing programs. As vaccines became more widely available, government supports in the form of the Canada Emergency Response Benefit, the Canada Recovery Benefit, income supports for people with childcare responsibilities, student support, sickness benefits, a whole range of benefits became available for some, but not all families who needed extra help. Now, the CERB and the Canada Recovery Benefit that followed it allowed many displaced workers to avoid even worse outcomes during the pandemic. Now, these weren't perfect programs, not by a long stretch. Their greatest limitation is that they still allowed too many people to fall between the gaps. But for a lot of workers, a lot of people displaced by the pandemic, they were a blessing. Now, as it looks like the pandemic may be leveling off, at least in many parts of the country, the cancellation of these temporary supports has been announced, even though we know that hours of work have not recovered to pre-pandemic levels, even though unemployment rates remain very high for some groups of workers. The self-employed in particular are still struggling. Once again, those least able to cope will be exposed to the greatest consequences in really very uncertain social, health, and economic times. So prices are rising, demand at food banks is increasing, rents are going up. Employment insurance has not been reformed to meet the needs of either the self-employed or precarious workers. No additional funding is being made available to provinces to support those who will be forced to turn to provincial income assistance as a last undignified resort. Ending the Canada Recovery Benefit with no transition plan in place for workers affected was neither necessary nor prudent. The pathologies that existed before COVID-19 are still in place. And this decision just exacerbates the inequalities that already existed before the pandemic came along. I think that one thing we should have learned over the past 2 years is that policy interventions always have unintended consequences that are very, very hard to forecast. And they're even harder to offset once they appear and we become aware of them. We know that population health depends on many complex and interrelated factors, things like income, education, race, gender, housing, and so on. We also know that upstream interventions, working to offset health inequities by addressing these ultimate causes, is often more effective than focusing all of our attention on crisis interventions and leaping from crisis to crisis. So the question I think I want to ask today, and what I'd like to focus on a little bit, is what if our response to COVID-19 was to minimize the need for crisis interventions? In particular, what if we put in place a permanent policy that would automatically respond, not just to health threats, but to any kind of threat to employment and income? An automatic stabilizer would not require politicians in different jurisdictions to make decisions cooperatively, nor would we have to decide when to implement such a policy or when and how to roll it back. It would automatically respond to economic and societal changes, expanding supports to those families who most need help without the need for politicians or civil servants to recognize a problem, to allocate resources, to forecast intended and unintended consequences. When conditions change and the economy begins to recover, an automatic stabilizer would contract, withdrawing additional supports from families that no longer need them. But the program would stay in place, ready to expand automatically should conditions change. Now, a guaranteed minimum income, a basic income, is such an automatic stabilizer. Rather than having public servants design and implement an income support program like the CERB in crisis conditions, a basic income would be ready to deliver to any resident of society enough to meet basic needs. No explicit decision would be necessary. When conditions change and other resources increase, a basic income will contract, again, without a conscious decision on the part of authorities. Those who need additional money would receive it when they need it, others would not. Now, I don't want to suggest that a basic income would replace all other necessary programs, particularly those that are focused on upstream health determinants, or even replace all crisis interventions. But a basic income that's paid in cash, that's easy to apply for, could simplify and streamline the multitude of programs we already have and that are offered by various levels of government in Canada designed to deliver cash to families. A basic income could ensure that resources are allocated to those who need them most, and it could empower individuals to make their own decisions about how to navigate the complexities of their own lives. I think that a healthy society demands no less. Thank you.
Lovely. Thank you very much, Evelyn. I really like that idea of this idea that basic income is an automatic stabilizer, a way of minimizing the need for thinking about how you set up these policies, not just for this sort of continuing pandemic, but also for problems to come. So thank you very much for that. And I'm sure that will lead to a whole bunch of questions and discussion. Now I want to move on to Nick Saul, joining us from here in Toronto, Ontario. Nick Saul is co-founder and CEO of Community Food Centres Canada, a national organisation that builds and supports vibrant food-focused community centres in low-income neighbourhoods across the country. Nick is a member of the Order of Canada, a recipient of the prestigious Jane Jacobs Prize, as well as the Queen's Jubilee Medal, and has an honorary doctorate from Ryerson University. Nick is also Chancellor of Victoria University in the University of Toronto. Born in Tanzania and raised in Canada, Nick studied at the University of Toronto and Warwick University in the UK as a Commonwealth Scholar. His best-selling book, The Stop, How the Fight for Good Food Transformed a Community and Inspired a Movement, was nominated for the Toronto Book Awards and has won several other awards. Pleasure of welcoming Nick Saul.
Thanks, Kwam. Great to be with you all. Hope people are doing okay out there. Well, I want to pick up on some of the comments from my colleagues on the panel. COVID-19, and I would say the murder of George Floyd exacerbated already deep divisions along class, race, and gender lines. As others have said, those with means could negotiate remote work, isolate, order in, get to the cottage. Meanwhile, our public transportation system was full of essential, mostly racialized workers who had no choice but to pitch up at low paying, often unsafe workplaces, and then head home to cramped apartments. We were never in it together, as others have said, same storm, very different boats. Increased poverty clearly led to connected to skyrocketing unemployment and reduced hours, meant obviously more food insecurity out there, more vulnerability, more stress. We saw a 39% increase in food insecurity, moving from 1 in 8 Canadians to 1 in 7. So an already very stressful situation made even worse. And illness and death obviously fell disproportionately on the poorest amongst us, just as the times before. So I want to kind of maybe shift gears a bit here, given the framing of these conversations about building the new normal. I want to make a few comments about things that maybe hint at the possibility of a better way forward, so long as, and I'll get to this on the back end of my comments, we advocate and mobilize for it. In my view, there is nothing more important than negotiating a new social and economic contract, one that challenges capitalism's hubris and short-termism and moves us toward an approach that is more, I guess, solidaristic, one that prioritizes people and the planet over the pursuit of productivity and profitability at all cost. I think most here would agree that we're in deep trouble if we can't land such an improved contract. So firstly, I'd say the vulnerability of so many during the pandemic fully exposed the exploitative nature of our labor market: low wages, no benefits, few protections. And it did so in such a way that I think it's helped. This is when I feel very positive, at my most positive. I think it's done so in a way that it's helped to chip away the misguided trope often trotted out by right-leaning politicians to justify cuts to our social infrastructure, that people are poor because they're lazy, that poverty is a lifestyle choice or a character flaw. And of course, nothing could be further from the truth. And as the many people who never imagined they'd have to stand in the lineup for emergency food now know from firsthand experience, people's vulnerability is in large part, in good times and bad, linked to a precarious job market. In other words, it's not the individual, but rather the system that determines how much food you might be able to put in your fridge. There's lots of organizing potential around this ever-growing recognition, in my view. I think the pandemic also revealed that people care about each other. While there was a lot of hoarding and selfishness, the general tone was kindness and generosity. People wanted to help. They donated, they volunteered, they banded together to support their neighbors. In crises, whether they're floods, fires, hurricanes, and of course pandemics, they seem to allow our true humanity to shine through. They somehow give us a license to be our best selves. They remind us that we're social beings and that we need each other to both survive and thrive. The work going forward then is to find a way to translate these individual and group actions, this caring, into the public realm, where it can manifest itself at a larger scale through more progressive, inclusive public policy, a bit like what Evelyn is talking about in terms of the basic income. And this brings us to government. The state stepped up during the pandemic, and it stepped up quickly. Wage subsidies and the Canada Emergency Response Benefit, for example, stabilized people's lives, staved off ruin for millions. It was a crash course reminder that government matters, that it's the vehicle by which we pool our communal resources, i.e. our taxes, to help each other. And so if we can do it during a crisis, why can't we continue to do this as we emerge from the pandemic and move forward? Particularly when we know that the best way to inoculate ourselves from future shocks that are sure to come is when we actually take care of each other. And we have momentum, I feel, going for us here. And it's good to see that the debt to GDP forces are remaining rather muted at the moment. And partly, I think, as I've just described, because the current mood is not on their side. It's on a different, perhaps more solidaristic side. Finally, I think we need to spend more time thinking and learning about CERB, that CERB experience. Even though the $2K a month was relatively modest, I mean, let's be clear, it only allowed people to make the poverty line, and that was it, about $24,000 a year, $2,000 a month. It did, though, reveal the gross inadequacy of income support programs like employment insurance and social assistance. And perhaps it set a new benchmark for adequacy that we can leverage going forward. And without a doubt, it forcefully reminded us that income matters. The way to reduce poverty, food insecurity, and improve health and equity goes through increasing people's incomes. So if we have better conditions to work with, the question then becomes, what do we do about that? We know that social solidarity benefits us all. We know that solutions lie in increasing incomes. And so what's the work ahead for us? And so I always say that change happens when you fight for it. And I want to give a few thoughts about our readiness for the struggle ahead from my particular perch in the social service, poverty reduction, income equality space. And the first thing I'd say is that we need to do a lot more work to support social service organizations, their leaders and their boards to feel more comfortable moving beyond frontline programming, to do more advocacy, to mobilize their communities into the policy change conversation. I thought CRA's elimination of the 10% rule on how much time could be spent on advocacy might create more enthusiasm for this, but it remains that a few organizations are doing a lot of the heavy lifting on this front. We need more in the game. And in the food space in particular, we need more focusing on the right to food and income rather than the mantra that charity will save us. So the struggle continues there, and perhaps in the conversation we can talk more about this. We also need more funders to step up to support civic engagement and advocacy work. We have no equivalent in our space, for example, to the Environment Funders Canada, an organization that brings together about about 50 or 100 funders to get behind ocean, climate, and nature work advocacy. Be good to see the United Ways and the community foundations lead on this front. System change work requires investment. Civic engagement work needs money. That's the oxygen for that work. And I guess the other thing I'd say is that we need to stick together. Currently, I've personally found a lot of infighting around this very question of universal basic income versus those calling for an income floor, to be won through a variety of existing programs that no one can fall below. We're all on the same team. We have similar end goals, although we may differ in the strategies and tactics to get there. So respect always, because we are trying to work together. And related to that point, I think as players in this space, we need to speak to each other a lot more than we do. We need to understand where we're going, how we can work together to make it happen. And this requires a lot of discipline and collaboration. Again, looking at the environmental space, we don't have an equivalent to the Strathmere Group, which corrals the largest environmental organizations to coordinate strategy and communications for greater impact. I also think of the work of the Green Budget Coalition. Again, it works with the leading organizations in the environment movement to hammer out its key demands and recommendations to the federal government. This united front makes it very, very hard for government to ignore them. I think we need to be doing the same in our space, working together, always having each other's back, because when we don't, government won't listen and they'll duck us. And just finally, I'll say that there are a lot of unlikely allies that I think we need to tap into. I was as angry as anyone when Galen Weston took away the pandemic $2 pay. And in the memo that he sent to 18 million of his Optimum subscribers, he said, I'm taking the money away. And then he also made the comment that he would continue to be a strong believer in a progressive minimum wage and would support any government-led effort to establish a living wage. Well, I think we need to get our act together to actually call him on that and see what he means. And we can only do that when we are together. So I'll leave it at that and look forward to the conversation to come.
Wonderful. I love the way this is going. I love the fact that we started with Ichiro with the mechanisms. We've gone on to Evelyn with a specific, Evelyn with a specific call for the basic income. And then we've gone to Nick, and Nick's done a brilliant job in talking about how we actually build collectively and what we need to do collectively to put this forward, including the idea that the social organizations need to step up. We need to think about how we bring in funders for social change, and then how we need to work together and perhaps be the change that we're talking about. And rather than the infighting, really work as a collective to produce social change. So very, very exciting, lots of different ideas. I wanted to start off really quickly, because I think that they all build on each other. But are there any questions, if I was going to give you a second, Ichiro, to ask a question of Evelyn or a question of Nick, what question would you ask?
I'd prefer to take questions from the audience, Kwame.
We can do it that way. I just wanted to open some space in case there are any ideas or questions that any of the panelists had, or if not, I will go directly to the questions. Yeah, I can see some nodding there. Let's go to the questions. So question one, we are currently in the midst of many different organizations undertaking DEI initiatives. Most of these initiatives correctly focus on race. However, there are obviously many other forms of inequity that intersect with but are not reducible to race. Do you think these initiatives have a potential for addressing income inequality? And if that potential is yet unrealized, what would you like those initiatives to do in order to address income inequality better? So DEI standing for diversity, equity, and inclusion. So Ichiro, can I pass this one to you?
Yeah, sure. So this is a debate we have on our side of the border in the United States. To what extent does do efforts to give priority to Black Americans, have an effect on income inequality? And obviously it does, because we know that under ethnic minority groups, racial minority groups in this country are overrepresented amongst people who were became unemployed and who fell below the poverty threshold during the pandemic, as well as all other previous recessions. And so any attempt to alleviate that pain is going to also have an effect on reducing inequality as well. Now, having said that, one important note that I would like to inject is that it's very important to keep sight of the fact that this is not just the problem of racial and ethnic inequality, that we have to keep the focus also on income and on income inequality, which is the topic of this panel. And I always say this because from a public health perspective, we've long said that in terms of health status, the poor Black person has a lot more in common with the poor white person compared to, let's say, the difference in health between a poor Black person and a rich Black person. The inequalities in health by income, across the income gradient, are much wider than they are racial disparities. And that says to me that what we really need to be thinking about is, even broader, universal kinds of principles to redress inequalities than focusing on race alone. I'm not saying either or, which is the kind of trap that people can fall into, but we need to do both. And we can't talk about one without also paying attention to the other.
Okay, perfect.
Yeah.
Nick or Evelyn, do you want to jump in there as well?
Well, I'll just say add a bit. I think you don't want to get trapped just focusing on income because race has a significant impact on where you show up. If you look at food insecurity across this country, whites are food insecure at a rate about 11%. New immigrants about 17%. If you're Black, it's 28%. If you're a single mom, it's 33%. And if you live in the North, it's over 50%. So very good work coming out of Proof in partnership with FoodShare on the role that race plays in food insecurity. Blacks are 2 to 3 times more likely to be food insecure than their white counterparts. And that has a whole host of reasons related to systemic discrimination, anti-Black racism, whether you're looking at that in the finance space, in the housing space, in the education space, in the criminal justice space. So it's important to intersect income with a whole range of issues. And I think race is one of the biggest ones to be included and to be thought about, and to have very, very clear policies that are tracking it. So what we do know, even, for example, that where you do have universal benefits, sometimes they are actually dealt with inequitably. And that's because often of not only unconscious bias, but pure racism. So we see that in our social assistance system today. So race is a major, major issue and is obviously anchored beside income.
Thanks very much. I would probably add to that the trap is to play one group off against the other, and that happens all of the time. But the other trap is that to try and make a certain type of initiative do everything, so it in the end collapses under the weight of expectation. So the reason why DEI initiatives exist is because there wasn't enough diversity, equity, and inclusion before. And to want to then add extra on top of them could make them unwieldy. One might say DEI initiatives, they should do the DEI work. And maybe we need other initiatives that focus on the unfinished business that we have to look at around income inequality, rather than put everything in one bucket. that might be something that we might think about. I'm going to go on to the next question because it brings you in, Evelyn, and it's why I didn't push you on answering the previous question. How can we counteract the argument that having a basic income will put small businesses out of business, that employers can't pay higher wages?
We used to hear that argument about minimum wage. We still hear that argument about minimum wage, notwithstanding the Nobel Prize in economics going to a guy who spent most of his career demonstrating that small businesses can pay higher wages. I think that people who focus on a basic income worry about the labor shortage. They worry about the work disincentives that they think are associated with the basic income. And I know that there's been a lot of reaction to the survey from some quarters arguing that people were staying at home to collect government supports rather than working. I don't know very many people who stay home for $270 a week, which is what the Canada Recovery Benefit is paying, when even a minimum wage job pays substantially more than that. I think that all of the evidence we have suggests that there are not substantial work disincentives associated with a well-designed guaranteed minimum income. And I think that we also need to recognize that it is possible to have a low wage, low price economy as we've been chasing for many, many years in North America. And it's equally possible to pay reasonable wages and to have a high price, high wage economy as operates in many parts of Europe, particularly Northern Europe. So I think we need to question some of those assumptions. And I think we need to look at the evidence that we've collected.
Also, oh, sorry, yes. Did you finish?
No, that's fine.
Yeah. I also, I wanted to link into what Ichiro had said, because we tend to get sucked into this argument of, can small businesses afford it? And what we've seen is that when we have big gaps between rich and poor, we produce weaker societies that then in the long term are very, very, very expensive, not just in money, but also with regards to health, illness, and during the pandemic, as we've seen, the bigger gaps there are between rich and poor, the countries with the bigger Gini coefficients. We're talking about tens of thousands of extra people dying who didn't need to die. I think that's one of the things you said, Ichiro, yes?
Yeah, no, I completely agree with the empirical evidence that Evelyn mentioned. I mean, when I studied undergraduate economics, it was drummed into us that raising the minimum wage causes disemployment, but it really took some empirical work as opposed to economic theory to suggest that the result was quite the opposite. And as Evelyn mentioned, that is what the Nobel Prize for Economics was awarded for this year to David Card. And of course, Alan Kruger's passed away, but that's illustrates the beauty of doing empirical work to put to the test economic orthodoxy.
Mm-hmm. It is interesting, though, and perhaps Nick, you jump in on this, is that the evidence, every time, the evidence keeps on showing the same thing. And yet, almost every discussion we have, we always get brought back to presenting the evidence again that giving the minimum minimum wage increases jobs, doesn't lose jobs, that basic income, good for health and probably good for economy. But yet, we still get this thing back. I don't know why it keeps on coming back. We keep on having these same refrains that are very difficult narratives to shift, Nick.
Well, I think my comments about how the pandemic has maybe created a different kind of psychology or a new cultural kind of framework for thinking about how we care for each other. And maybe that's Pollyannish, maybe that's overstating it, and I'm happy to talk about it, but I do think that maybe we won't have a provincial government next time that gets elected like a conservative government, and almost immediately They attacked the minimum wage. They attacked important sick day leaves. They attacked the right to unionization. And so I just can't imagine that I hope this isn't the case, but in 30, 40 years time that we're going to look back and say a sustainable business meant that you didn't pay your workers enough in such a way that they had to go home to empty fridges. What sense does that make? I just heard a story from a focus group in one of our centers where there's a fellow working for a pizza chain. And the fellow negotiated with his employer, who was himself being grinded by the bigger company, to sleep over in the pizza shop because he couldn't afford housing. And the person who owned that franchise said, yeah, you can sleep here. Imagine, here's a person who's working full time who can't afford a place to go to. And so the evidence is clear, as Ichiro and Evelyn have said, but we do seem to be, every time it comes up, we're in the same spot. And I think we need to push through that by the kind of mobilizing I just tried to describe.
And just to add on that question of the mobilizing and thinking about that, one of the questions that's come up is really not a question, it's a statement, but it's a jumping off point, which is the government response to COVID put money in the pockets of people overnight, and that broke the myth that something cannot be done because of deficit worries. And it seems like people have done that all over the world. How do we build on that? Is that something we can build on?
Oh, absolutely. Well, I kind of remarked on that in my comments. I'll let others go first.
Ichiro, Evelyn.
So the question was, how can you mean a timeline for building?
No, how can we build on the fact that governments have shown that they can, put money in people's pockets without worrying about the deficit?
Right. Yeah. No. So I don't know. I mean, the barrier that we face with each time that you mentioned, Kwam, I think it takes me back to Upton Sinclair's comment that the most difficult thing to do is to make a man understand something when his livelihood depends on not understanding it. And it's just another way of saying that we live in an ecosystem, media ecosystem, financed by billionaires and right-wing people, and which itself is a kind of a reflection of the pathologies of income inequality. Income inequality concentrates the ownership of media, of think tanks, of funding to those organizations and individuals who stand to profit from the continuation of the system. And so, changing the conversation and changing income inequality has to go hand in hand with the way we think about dissemination of information that would make for a better society, I think.
Okay, so are you saying that we should be nationalizing the media, or do you think we should be?
That might be one solution, but how about changing the FCC rules in the United States about concentration of media? A lot of concentration of media ownership. For example, a generation ago, I think there are about over 50 television stations and broadcast stations that were responsible for disseminating media, but now it's down to 3 or 4. And a lot of that is not accidental. It really hinges upon regulatory authorities, which have to look into the question of monopolies, and we just have to go back to the basics of regulating for reducing inequality.
Okay, perfect. I wanted just to pick up one question. It's a technical question, Evelyn. Has costing been done for the UBI for all of Canada?
Yes. Yes, there are several costing estimates out there, 3 of them by the Parliamentary Budget Office, which demonstrates that a guaranteed minimum income is an affordable outcome for Canada. When we say we can't afford a basic income, what we really mean is that there are other things we'd like more, like tax reductions, low taxes, and so on. But yes, it's certainly something that is conceivable within Canada.
Do you remember any of the figures, or was that pushing a bit too to remember.
For me to spend a lot of time on it. Well, I think that the part of the distinction is to recognize that we're already spending tremendous amounts of money in this country to address poverty. Right, we're spending tremendous amounts of money at every level of government to get money into the hands of families. We don't do it very effectively. Many of the people don't get all the benefits that they're entitled to receive simply because it's so complicated to apply for all of these various programs. So if we take these various programs that are being offered by the provinces, by the federal government, in some cases by cities, we put them together, we streamline them into a basic income, we can actually pay for it. We can actually pay for a basic income, not a generous basic income, but a basic income that at least guarantees people a reasonable standard of living.
Yeah, I think at one time when I looked at it, the amount that the amount that we spent in the last year on COVID would have given us 10 years of basic income, something like that.
Tremendous amounts. But we also need to remember that much of the money we spent on supports for COVID did not go to individuals. The biggest bulk of that money went to corporations and to small businesses.
Yeah, I understand. And as I said, if we had just given it to individuals, we'd have had 10 years worth of basic income, it looks like, which would have been a very interesting way to start the recovery.
To measure the outcome.
Yeah.
Can I just say something else about the resistance to the benefits of dealing in a reasonable way with poverty? We forget the consequences of poverty. All of the work that Ichiro has done, for example, focusing on the health consequences of poverty, people imagine somehow that these are costless, that there are no costs associated with dealing with the consequences of poverty. And I think it's really important to keep mentioning that point, not only in the area of health, but in so many areas of our society, in terms of incarceration, in terms of education, special education programs, and so on. All of these carry with them tremendous costs.
I think I saw one estimate, which was that costing somewhere like $34 billion a year. If we keep people in poverty in Canada, we're over 30 billion just to keep people in poverty, which seems sort of crazy. But the economic arguments are interesting. The values arguments around what are we trying to do as a society, and where do we want to go, seem I think more germane. And interestingly, from the comment beforehand that showing that things can be done without without people worrying about deficit is all about, as you said, deciding what's important. It was decided this was important, so it could be done. And so I think the values are really important. I wanted to turn to Nick because we've got a question here, which is another statement question, which is history has taught us that when we have worked with others to achieve progress, Black people have been left behind. How do we prevent that from happening in these initiatives? So when sort of Black groups have worked with others and instead of it being focused on anti-Black racism or the needs of Black populations, somehow they've worked with others and then been left behind. How does that work when we're thinking about this idea of sticking together, respect, and getting the social organizations to step up?
Well, I think it starts with listening and acknowledging the various challenges that those communities face disproportionately than others. And I mean, in our work, as I've described already, we acknowledge that race plays a significant role in outcomes relative to food insecurity. So I think it's incumbent upon us as an organization to front that information and work doggedly to overcome it. I mean, our focus is on income, but we absolutely know that race has an enormous role to play in how people how people live their lives. And so we're going to talk about that. We're going to talk about systemic discrimination, anti-Black racism, and we're going to work with groups who are leading on that front and provide space for them, and if we can, provide resources to them to do their good work and to be allies and to stand in solidarity with them. Because not only do we have a lot to learn, but we have a lot to contribute in those conversations. And I think we need to do it together. I mean, the challenges around poverty and food insecurity that are rooted in income means that when we actually fight for policies around income, that they are equitably distributed, that we have a race equity lens on how those benefits are distributed, so no one is left behind. We need to measure that. We need to track it. We need to collect race-based data. We need to disaggregate data so that we're looking at the nuances of how these programs play a role. And if they're not being positive for X or Y community, then we need to do something about that. But you know, right now we're falling way behind on tracking this kind of stuff. We've got a lot of room for improvement there. And we're an organization, particularly around race and food insecurity, that will be joining others who are doing this work and advancing this work to say we need to do better. We need to track this stuff so that we can actually respond with good policy that includes everyone.
Okay, so I wanted to, there's another question coming your way, Nick, and I think other people can join in as well. Many service providers, such as homeless shelters workers, for example, are living on impossible wages themselves and struggle with poverty. They're also pushed by their funders towards depoliticizing their practice. How can we, as service providers, represent the people we serve when we are often scared to speak out loud against our funders?
Yeah, I mean, my position is that, and I think it's more complicated for organizations that are funded by government. So I'll say that it is trickier, but I'm a big believer in biting the hand that feeds you as much as you can. So, you know, we never back away from talking about, yes, we do frontline programming and we build respect and community and connection in our community food centers, but we're not going to be shy about talking about the structural reasons why people are struggling to make ends meet. And that includes talking about public policy, of course, and the exploitative nature of our labor market, the fact that our social infrastructure is not allowing people to live with dignity and health. We are not going to back away from that. We have two lungs in our organization. One is respectful space where we meet people where they're at, and the other is talking very firmly about the policy change that needs to happen for us all. As we're saying, when we take, you know, when we take a more solidaristic approach, we all benefit from that approach. I think this is a very complicated issue, and I understand why organizations are very scared to talk out, because funders carry a big stick. And if you're an organization that is funded mostly by private foundations, for example, or private individuals, you will feel a bit you will feel a bit shy to speak out at some of these things, because ultimately the people who are paying for the programs and services that you're running might not agree with your kind of ideological perspective. For me, it starts from like, what makes a healthy community? I mean, it's neither right, it's not right or left, it's what makes a healthy community, and how are we going to build a community that allows people to flourish, not just to survive. And so I think the more organizations that have the courage to speak to their funders in those terms and say, this is why we do what we do, because it's ultimately about supporting our community to realize their hopes and aspirations. And you know, you're going to lose a few funders probably in that, but I'd rather be speaking up about our core values and not really worrying about where that funding is going to go, because there'll be other funders who come along and understand that what you're about and what you're trying to achieve. And that's been our experience, is that you just be true to who you are and speak out on behalf of our constituencies. Are the community members that walk into our community food centers, and they are suffering in all sorts of ways, and we need to stand in solidarity with them to say enough is enough and we need better.
Okay, so that's a really, really wonderful, comprehensive answer. And now I've got a question that goes across for everybody but is still coming back into this idea of intersectionality and how that works. How does race, racism, and geography factor into conversations about income inequality? In Toronto, we know that poverty is concentrated in certain parts of the city. This co-locates to where racialized populations live, where the worst schools are, and the communities that have the poorest health outcomes. We also know that poverty manifests differently for different racial groups. For example, poverty for Black populations in Toronto is generational, whereas for others, it declines across generations. So poverty rates decrease from first to second to third generation for most populations, and increases from first to second to third generation for the Black population. Given this complex set of factors, how do we know a universal approach to basic income or income security would work for Black folks in Toronto? So I did warn you, we have a really, really, really great audience here, and they're going to ask some tough questions. So Ichiro, Evelyn, and then Nick.
Sure. So I read the question to be asking about the spatial reproduction of income inequality, and the way in which income inequality reproduces itself spatially is through residential segregation. Now, as the question asked, a lot of attention has been devoted to racial residential segregation, namely Black people tend to live in different neighborhoods than white people, but a neglected dimension is economic residential segregation, which is even more serious than racial residential segregation. People don't sort of often think about that. In the United States, for example, racial residential segregation is very high, but it has been pretty much stable over the last decade, whereas economic segregation continues to grow worse. And in econometric studies, it's been shown that every time income inequality grows by one standard deviation, that measures of economic segregation also goes up by about half standard deviation, with a lag of about 10 years. That is, as the rich and poor begin to pull away in terms of their income, the rich will often uproot themselves and move into more isolated, segregated communities with attractive public schools and amenities. And I'm going to say that residential segregation, the spatial aspect of income inequality, is actually the engine of intergenerational inequality that the the person in the audience asked about. If you look at the United States, where you live and grow up is a huge determinant of the quality of education that you will receive, because public schools are funded by local property tax. It is a huge determinant of your access to the job market, to services, and all kinds of amenities. And I think this is something that income inequality is also causing to happen at a kind of spatial scale. I do think, the solutions, there's not just about trying to level the distribution of income, but now we're getting into talking about housing policy, of urban development policy, and so forth. So it's a multi-pronged issue.
Okay, thank you. Evelyn?
Yeah, I agree with all of that. I would like to add something to it, though. I live in Winnipeg, and in Winnipeg, poverty is very, very much racialized. And it's racialized not so much with the Black population, but with the Indigenous population. And I've learned something, I think, in the past 2 years that I knew, but I didn't know until it really came home to me. I've spent a lot of time talking with people who are involved in the report on missing and murdered Indigenous women, commissioners of the report. And one line kept coming up all of the time, and that is that one of the ways that systemic racism, one of the ways that anti-Indigenous bias, colonialism finds its way into our society is via the social programs we put in place to help people. So we set up all kinds of targeted programs to address specific ills. And those targeted programs are constructed, they're implemented, and they're evaluated by members of the dominant society. And they worsen the conditions that many people find themselves living under. And I keep hearing that, and I kept hearing it over and over and over again. And I think that one of the conclusions I've drawn from that is the importance of putting in place programs that allow people to make their own decisions about their own lives. And I think that's one of the strongest recommendations for a basic income, but not just for a basic income, but for programs that allow people to make their own decisions about how to live their lives, rather than putting in place programs that carry with it so many of the values that in many cases we're very unconscious of, as we put in place programs that are designed to help people. Not sure how clear that was.
Very helpful, very helpful. It does move us into, unless Nick, you wanted to jump in, it moves us into a different question. Nick?
No, I mean, I'll just reiterate that we need to ensure that when we do set up programs, and Evelyn is pointing out that there are lots of inequities in terms of the way they're applied, that they are applied equitably. And I mean, the race equity lens, I mean, I'd like Kwam, you at some point to speak more about the race equity lens on the way services are delivered, because it is something that I don't think, as Evelyn is pointing out, we do a very good job at. And we have to change. If we were ever to win universal basic income, for example, we would absolutely need to set up systems to ensure that that is equitably, it equitably reaches the populations that are disproportionately disadvantaged around income due to race. So yeah, I'll reiterate that if you're going to set something up, you better make sure that it's applied equally.
Okay, thanks. And the question leads off from this. It says, does it have to be UBI or targeted supports? Could it be both and? Where does living wage come in? Shouldn't those that gain the most from the economy be central to paying the supports? Evelyn?
Absolutely. Absolutely.
So it could be both and
well, I think it needs to be both
and tax isn't a four-letter word, right?
Absolutely not.
Okay.
3 letters, I think.
Ichiro?
Yeah, I want to inject a bit of a cautionary note. I mean, I also think nothing in policy should be either or, and targeting is very important for hard to reach groups. But speaking at a broad level of designing sustainable social programs, it's very important to keep the universalist principle foremost. We've seen many times through history, as well as in empirical analyses by people like Walter Kirby, that when social programs are designed to be targeted, they always end up being less sustainable compared to universalist programs. I mean, you consider the greatest anti-poverty programs in the United States are Social Security and Medicare, both of them based upon universalist principles, whereas programs like Medicaid and what used to be called welfare, these typical means-tested, targeted programs, which on the face of it would seem to be very equity promoting, because after all, what could be more equity promoting than saying we need to target resources to those who need it the most? But history tells us that the moment you do that, it becomes the target of a kind of a us versus them sort of erosion over time. Conservative think tanks know very well how to do this, and they chip away at it until gradually public support for these programs begins to erode. And you can see this clearly in the federal funding for programs like welfare and Medicaid, which have declined over time compared to what we call the third rail of politics, which is Social Security and Medicare, which, God forbid, should anyone talk about touching that, you'll have instant political death. And I think it's an instructive lesson in why we should whenever possible, try to advocate for universal kinds of programs. And universal basic income is an excellent example of that.
Okay. Fabulous. And Nick?
Actually, no comment from me.
Okay, so there is another question that we've got in, and there have been, as you can see, there are lots of questions coming through, and there were questions that were sent beforehand as well. So what is the role of local government in affecting income inequality and creating the conditions for health equity? Is there an argument to be made for improved efficacy of social services tailored to meet diverse local needs, which require a nuanced understanding of the local context and cannot be offered by other levels of government that do not understand them as well? Lots of nods there. What do you think, Nick?
I'm looking at Ichiro, who seems to be nodding the most vociferously on this one, the most committedly.
Yes.
I'll take your cue.
I completely agree with the sentiments that were expressed. Local, providers and service providers know the local context, and they should be, consulted and lead many of these policies. I totally agree. I mean, I do think the caution is, under a kind of a federal system as we have in the United States, where a lot of these anti-poverty programs are administered by state government, which is, to my mind, a recipe for replicating inequality. And so I'm again, by temperament, I tend to be sort of, we need to have the sort of balance of centralist things that guarantee, certain level of services and resources for different programs, and that beware of taking that too far to say that localities should then determine how and how much to spend on local services.
Yeah, because I think that's one of the things that they found during the Thatcher Revolution. They sort of, your local borough needed to raise money for local services. Yes. And so it was hardwired the fact that poorer places where there wasn't, it was much more difficult to get money through local taxes, had fewer services.
Right.
And worse than that, people who could move to richer areas, and thus undermining the tax base even further. Yes. And so I think this idea of universality and having, really the basic income is about a basic floor. It's not really saying that's all that should be done, but universality, but targeted local programs to try to meet the needs of different people. I think this is where the different bits of the conversation have been going.
I mean, that's Kwam, that's where I fall down a bit in terms of UBI, and I haven't in a long time spoken to Evelyn, but like when I think of things like the Canada Child Benefit, and when you look at the evidence there, that there has been quite a bit of focus over the last few years in terms of putting money in to that benefit, it has actually reduced severe food insecurity in households with children by about 30%. So again, I mean, it reinforces the idea that income matters always. And similarly, at the other end of the spectrum around seniors, because as soon as you turn 65 in this country, because of old age security or CPP and guaranteed income supplement, food insecurity rates drop by 50%. So, I mean, those are things that I see just kind of politically on the table as areas that we can push and drive, and they kind of speak to an income floor that no one can fall below. And if you put them together, you maybe get that you're working toward again, maybe it's just the language, basic income versus an income floor that no one can fall below. And I kind of get caught trying to sort that one out. And I don't know what your position, Evelyn, is on that, because I see lots of evidence of possible benefit routes that will create that good floor. The fight will be over how much, obviously, and what the adequacy looks like, how easy it is to access it, not run people ragged to get it, etc. So I don't know, any thoughts about that to help clarify my thinking?
I think that most supporters of basic income in Canada would see the OAS GIS on the one hand and the child benefit as forms of basic income. The
Right.
great gap in our system is for 18 to 64-year-olds, the working age population,
Working age adults.
and doing something about that particular population. If I can come back to the services versus money thing a little bit, I mean, there really are principles involved. I mean, the federal government's very good at raising taxes and handing out money. It's not very good at offering services that are targeted to local needs, or, you know, dealing with local housing markets, or, you know, food costs in the north, for example. Local governments are much better at that. And, you know, when governments stick to what's appropriate for them, they do a very good job. They do less well when federal governments try to interfere in the delivery of services, or when local governments try to impose big income redistribution schemes. So, I mean, I think it's partly a matter of, you know, choosing your track, so to speak, staying in your lane.
Okay, well, we've covered a lot of ground, but one of the things when we're talking about building the new normal is we've talked about policy, we've talked about services, we've talked about trying to target, we've talked about universality. And I want to go back a bit to Nick's theme about, you know, moving forward and social organisation. But the question that's come at an individual level. It's, how can a regular person make a change when it comes to addressing income inequality? What can be done? What can I do?
It's a bit like when we're asked the same question about climate change, isn't it? Sort of broad problem that is threatening humanity, if not the globe. And you know, when it comes down to what difference could you make individually to stem climate change? So there's some things that undoubtedly we could do as individuals. Stop watching Fox News, for example, and, you know, become informed about some of these issues that we've been discussing in the last hour. Unfortunately, a lot of the actions, sustainable long-term actions on income inequality will require, you know, big changes implemented at the level of governments and maybe the corporate sector. And they will also take time, because there's a lag between changing income distribution, for example, by, you know, subsidizing childcare, universal preschool, and then seeing its effects on the distribution of income, you know, a decade, 2 decades later. So, you know, that can make, you know, some of us feel a little bit pessimistic about what we can do personally. But I don't know. I think the most I can say in my position as someone who researches this is to stay informed, teach others about why you think this is a threat. And by all means, go out and exercise your right to vote for the parties and politicians that you think will help toward fixing this problem.
Okay, perfect. Evelyn, Nick.
Yeah, I agree with that absolutely, and I'm going to hand this over to Nick in a minute because this is his thing. But I just want to say that governments really do respond to people. And I've been extraordinarily surprised by the amount of local organizing that's gone into all kinds of areas. The number of groups that have coalesced around clubs or around political groups that have raised these issues and continue to raise these issues with governments. So, I mean, I think that, yeah, join groups, join clubs, vote, you know, stop watching Fox News and the equivalents. And I'll pass it on to Nick because that's really his thing.
And also, I saw that the amount of impact to the climate from streaming Netflix. So there's
Yes.
incredible footprint from streaming Netflix, and this idea of giving up part of your Netflix watching to joining a group and getting organized locally and push for social change is something that is the sort of thing that people could get behind, I'd expect. Nick?
Well, I think it's really easy to feel paralyzed given the scale of the problems. And And I absolutely agree with Evelyn that politicians actually need us. We're the oxygen for them. And they do listen when you push. And I think you push by organizing. I mean, that's the way things change. And I think it's also easy to think that nothing will change. And yet things change all the time. You know, civil rights, same-sex marriage, women's right to vote, minimum wage. I mean, those things weren't handed to us. They were fought for and won. And so I think, as Ichiro said, like getting involved is really important. I guarantee you, there is an organization out there that is working in the space that you feel passionate about, that you want to change, and they need you. They need you to lick a stamp. They need you to copy edit the website. They need you to do a deputation. They need you to go to Parliament Hill. And not everyone has to be a leader in that, but it all adds up to change. And I think that's a really important thing to remember, that you have agency in this. And I see hope in action. That's where my hope springs from, is when people band together to say, that's not right, and I'm going to do something about it. And you know, Martin Luther King said that the arc of the moral universe bends toward justice, and it doesn't bend toward justice because it just bends. It bends because people get on that and pull it toward justice. And I think that's something we should always remember. There is a space for you in whatever struggle you want to get involved in, and there are lots of struggles, and we need you. So come on, what are you waiting for? Join.
It's interesting. It's interesting to me, just adding to that and adding to what Ichiro and Evelyn have said, is that there's this statistic that I read in one of these investment magazines recently, that last year, 50% of shares of money that was invested in the United States was invested ethically. 50% has gone to environmental, social and governance investments. Yeah. And that is significant leverage. And that's people doing small things to get involved. And so everybody always thinks it needs to be big. But as you said, there's voting, there's listening, there's talking, there's all of the things that you do in order to change the narrative and change the environment. And that change of the environment allows other people who have more time, more energy to do the things that they need to do. It's keeping silent and not being part of it. That can be the real social cancer. And it is the social cancer that is pushed forward by income inequality. Yeah. This idea that there are very rich people who do things and you can't do anything. And reversing that, I think, is going to be vital. We're coming towards the end. I just wanted to...
Quam, can I make a plug? If that person is coming from Toronto, there'd be...
everybody and say, does everybody want to say one last thing? Let's start
with
you.
What I was going to say, if that person's question, if the person lives in Toronto, like I'd put a plug for Dina Ladd's work at Workers Action Center. And I'm sure, you know, Evelyn, there's a similar organization in Winnipeg and Ichiro where you're at as well. But Dina's work is formidable, and they need people to help push. So again, I'm just reiterating this. There's a space for you, no question about it.
Okay, so, and is there any last comments that you wanted to make on reflection from the way the conversation has gone that you wanted to make? We've got a couple of minutes left.
Do you want me to just quickly answer that?
Yeah. Let's carry on with.
Well, I mean, I would say that one of the great. I mean, it's been great to be with Evelyn and Ichiro, and I've learned a lot through this process. And in fact, the best part is it forced me to stop my work for a bit and just reflect on what's going on, which was super, super helpful. And in that process, I realized that we're maybe not as good at reaching out to other players to collaborate on, particularly trying to affect policy change. And so in writing my remarks and thinking about it, I was like, okay, we've got some work to do. I mean, I can think of an organization that philosophically I'm not, you know, aligned with, but when it comes to income policy advocacy, there's a lot of overlap. And so why aren't we working with them? And I think that that just speaks in general to the importance of us getting together, because it's easier to go knocking with one or two requests than to have 25 organizations screaming at you for 50 requests. And that takes a lot of work, as I said. But governments take electoral reform. There's so many versions of electoral reform, they just walked away from it. We don't want that to happen on the income inequality file. So I think that I've taken from this process a renewed or a commitment to actually find partners and work with them on this.
Perfect. Evelyn.
Yeah, I've enjoyed this conversation. It's been a lot of fun. And I think the one thing I walk away from is the belief that there aren't many of us who want to see things go back to the way they were before. We can do better.
Mm-hmm.
Wonderful. Ichiro.
Yeah, this may be one of these occasions for a reset in the way we think. And I do think that it's interesting to me that when I started in this field 20 years ago, income inequality was a kind of a no-no, really. We were sort of a mixture of censorship from the outside and self-censorship. But I do think we're at a point in history where income inequality and climate change have come to be viewed as the two existential threats to societies as we know it. I'm sort of at once heartened by the fact that we're having these conversations, but also, I fear that, like climate change, the greatest threat that we confront is apathy, actually. That apathy that we can't do anything, or that the people who have stuff in society coming to view inequality as being somehow natural, normal, inevitable, and deserved. And I think that's the opposite kind of threat that we have to constantly deal with through educating ourselves and others and encouraging action.
Wow. Well, we're at the end of today's events, and I want to thank Ichiro, Evelyn, and Nick, and thank you everyone who's been attending virtually. Wonderful questions as always. A reminder that our next panel and the last installment of Advance 2021 is on Wednesday, November the 10th, and it's not long to wait, and it's not too late to register. We'll be discussing climate change and health. So wonderful link there, Ichiro, and hope to see you there. As soon as we finish here, there'll be a short survey that will appear on your screen in your browser. We'd really appreciate it if we'd have your feedback on today's event. This has been a wonderful event. I knew it would. We've had brilliant people speaking, brilliant questions, and we have covered a lot of ground. And so thank you to the panelists. Thank you for the people who've organized this, who are there in the background. And thank you for being here and staying with us through this webinar. And stay safe and go in peace. Thanks. Goodbye.
Thank you. Bye-bye.